good morning. We have an eminent panel with the leaders of the government here. They are representing the NITI Aayog, the government of Maharashtra and government of Uttar Pradesh. And each of these leaders are doing some exceptional work in the healthcare sector. So the topic of this panel is about healthcare in digital India, bridging the gaps in healthcare innovations. The idea is that healthcare innovations in the whole country, the country of India's size, is like there are innovations happening across various states, across various cities, across various sectors, including government sector, private sector, startup sector, academia, and various other organizations. Now, these innovations are spread, and there are many times gaps in like sharing of knowledge, sharing of ideas, and also scaling up like these ideas of innovations. So, before we start the actual topic of the panel, I will request each of the speakers to first of all throw some light on the healthcare innovations and especially digital healthcare innovations happening in your respective states. So let me start with asking Ranjan Kumarji, who is the Secretary, Department of Health and Family Welfare, Government of Uttar Pradesh, that if you can talk about the digital health journey in your state and what are the challenges you have faced in digital health implementations, what are the success stories, and what are the opportunities you are seeing?
Thank you so much, Ravi. And I feel always elated when I am part of your this very interesting conference on very interesting topic, very relevant at this time. Because see the population of Uttar Pradesh. We have to cater for, and this is also divided into many geographical climatic zone. So they have different symptoms and diseases. So you have to cater to the needs of different kind of symptoms and all. So we have huge frontline workers and the lakhs of ASA workers and all, who used to take this point of care tests and they take note of symptoms and other thing. They go door to door. So this is a huge exercise. So in this background, you need to have digital something health solution. Otherwise, it's impossible. If you go by the legacy system, which is basically you manage hospitals, people used to visit and nurses and doctors are there. So you have two kind of option. One is either you integrate with emerging technology or you go for the complete change of your system. So that it caters to, if I divide this into three parts, suppose you have to prioritize resources. That is the most important decision making for the government. You have limited resources and you have to prioritize it. So prioritization, that requires people and people-centric digital healthcare solution. We were talking about, Madhukari was talking about universal health coverage. So you have to think of people-centric solution and also evidence-based decision making. And also you have to see that there are people living in the most remotest, like in Sonbhadra, and who are underserved people, how to connect them, that accessibility. And then the second part of this is the connectivity. How do you connect the different solutions? There are millions of, I think more than 96,000 applications in digital sector. Digital health sectors have been developed. There are information system, informatics all over the world, different countries, how to connect them. And you have to do collaboration with different departments. So when we talk about digital India, so we cannot complete this digital India without digitization in healthcare. And the third part is about scaling up. So here comes the role of private sectors. So we think about different ideas, different digital initiative to embrace these things, but how to scale up? So you need a lot of financing and ideas and the discipline from the private sector. So here comes the PPP and other things. So like in ABDM, Ayushman Bharat Digital Mission, Uttar Pradesh government is pioneer in this. So we are almost number one in all of the parameters, the number of Aadhaar ID created, the health record and other things. So we are very serious, and Government of India has started new initiative to bring private sector into this by innovative concept of microsites. So they experimented in Mumbai, your state, and in Gujarat. So there was huge success. So the idea was to one-to-one discussion with the private sector. There are a lot of the issue of trust and myths. So you have to get them these clear about this is the only option in the future. In the future, nobody can think of offering healthcare solution, healthcare in this field without being digitized. So we have seen in the private sector, like in eye hospital, where everything is digitized, and many things I have seen in private sector already happening. So now I will talk about something which UP is doing. So very interesting. So two important concepts in digital thing. One is data management, and the other is applications and dashboards. So how these two talk to each other and how these are very important. You have huge data. So look at the data. Our ASA worker, they collect data of symptomatic persons for various diseases and syndromes, like influenza, like illness, vector-borne diseases, TB, leprosy, filaria, Kala-Azar, and they put it on 𝐏𝐚𝐬𝐬𝐭𝐬 portal. So we have more than 21 crore enumeration on 𝐏𝐚𝐬𝐬𝐭𝐬. So almost every person is enumerated on 𝐏𝐚𝐬𝐬𝐭𝐬. So you have huge data now of almost all the population. They have symptoms, ILI and other things. So how to manage that? How to give the best quality health services? So we have developed unified disease surveillance portal. We were talking about integrated surveillance portal that was for all the states. So we have, above that, we have unique, our own state initiative, that is unified disease surveillance portal. This basically, they track the number of cases in different parts of the state. And the important point of this digitization is the health action done by the state. How do you act on this? So we get the analytics from this portal, and we send teams, and immediately we take care of these diseases on the point of care. So, so interesting thing that the data is basically flowing among all important, like surveillance team, laboratories, and the block level facilities. Everybody can see the data in intelligent form. So that, which is important, that they understand those data. So huge data is being seen by everyone, and the decision maker can see this on dashboard. So what kind of decision you have to do? So prioritization become very easy. So we have to send team there, not everywhere. So we are working daily. So on my mobile, I get in the morning, daily, that which area is important for surveillance for this. So that is very helpful, and we have done a lot of good work. There are many case studies there. And then we have developed mantra application. So they take note of all service, various facility service delivery and outcome parameters. And similarly, that is seen by all them. So we can take different innovative healthcare decisions. So we also we have a huge network of telemedicine and teleradiology. So we have 70,000 consultations per day. And till now, we have more than 2.5 crore e-Sanjeevani consultations. So this also creates data, and so you are catering to the needs of the most underserved people through these initiatives. We have done UP KSK Care and Manav Sampada. So Uttar Pradesh ke Seva Swasthya. So all facilities in UP is geotagged and mapped. So we easily through API, we easily can reach anywhere on different. We have done recently. We have mapped all the accident-prone area with the trauma centers, and that is given to the National Highway Authority also and our control room 112 of the police. So when the accident occurs, immediately you have no uncertainty about where to send him. So you have one-to-one mapping. So immediately you take him to that hospital. So that is mapped. So all get the information directly from the ambulance. The doctor is ready to take that patient. So we are working on that. So that will be a huge solution for this. Then we have done e-rupee vouchers. So access to all. So we have done whoever comes to the day, the elementary checkup, and they are given tokens. So immediately they can go to any private ultrasound services, and that is free of cost ultrasound checkup. So this is now 100% people in UP, they get this service. So all the universal this ultrasound checkup is being done. And this, as I talked about other things like MRI and CT scan, all private sector is being integrated in our services. So Ayushman Bharat Digital Mission, we are working day and night to bring it to the level where you have a mobile and you just scan it, and you will get a call from the doctor, and he will see your all the health records, and he will advise you, don't panic, it will be done. So there, if you look at the emerging trends in health sector, you have concept of this AI is coming a big thing. Like they can help your health person to do this scheduling and advising, and their assistant chatbots. There are so many initiatives, but we are far from implementing this. So we are trying to bring private sector. So if you look at the market, it is more than $5.4 trillion dollar market. So people are investing in database, HMIS, and other things. So we are very much aware of things, and we are working hard to bring all into this health sector.
I think fantastic. I think it deserves a round of applause from the audience. So much digital health initiative has happened in UP, from collecting all the data, digitizing it, putting on a dashboard, having real-time reports, real-time access to various stakeholders, and real-time action on all these topics, which are enabled through data. So it's a huge leap, I think, from paper-based records, which all have been happening earlier. So we have the opportunity to have listen to another state, which is Maharashtra, which is again a huge state, big state with a lot of population. And we have Mr. Nawin Sona, who is the Principal Secretary, Public Health Department. And like UP, Maharashtra is highly diverse, highly high urban and high rural populations. Even you have like some of the Naxalite areas also, which are highly inaccessible. So handling a state like this and applying like IT technology to manage the whole healthcare department. So if you can talk about those initiatives.
Good morning, everyone. First of all, thank you to Dr. Ravi Gupta and his Elets team for having me over and having Maharashtra over this great event. And every Elets event is an eye opener. So I think E in the Elite stands for eye opening because really it's a great intersection of public and private. Um, so Maharashtra, as you rightly said, is a pretty complex state in terms of healthcare because the entire spectrum is so wide, starting from the most expensive, highest grade of hospitals in Mumbai to a single room, single doctor clinic in some corner of the state. So to bridge this gap, naturally, we learned through COVID, how Mumbai managed COVID, how COVID has been a eye opener, a game changer for Maharashtra. So huge digitization started, I think, through COVID learnings and managing the vaccine supply, the oxygen supply, the bed management, the ambulances, and so on. So now, in this period, uh, I would highlight a couple of major decisions that we have taken and how that is impacting the way we are doing it. The first major decision, I think, is we have adopted, our cabinet has adopted the universal healthcare policy. So, which is a tremendous challenge for Maharashtra. That which means we have the PMJY and we have the Mahatma Phule scheme, which is the state scheme. So together we have like equated both the schemes and we are giving universal health coverage. So which practically means there is no income criteria for availing secondary tertiary healthcare in Maharashtra in the empaneled hospitals. So we have bumped up the hospitals from close to 1,000 to 2,000 hospitals now. When just we are waiting for the election results, so the roll off will happen now. Huge preparations have gone. What does it mean? So here we are looking at eligibility of any person who's domiciled in Maharashtra with no income criteria to be able to get the package of services. So unimaginable without digitization. So the whole pipeline. So we have our own software. We have a huge team working on it, which is doing the whole pre-authorization management, and we even have a state anti-fraud unit. We are putting in the cutting-edge technology like AI and so on. Because when you bump up this kind of volume, you have to look at resources and prevent misuse of resources. Uh, that is one of the biggest changes. Second thing is of preventive health. So, with the Prime Minister's vision, Maharashtra went full steam ahead, and it was taken that preventive health is the main thing to do. So, the amount of saving in economy, so when we look at preventive health, what do we really do? I am happy to share close to 5 crore people. We started with women. We started with then children below 18. Then we are doing adult males and children. We have screened them with blood tests, with X-rays, with every single kind of test. So we have a health profile of close to 5 crore persons in Maharashtra, and we have that's all in digital format. We are merging it with the EHR, so it's giving us a whole cross section of the entire population. So we're able to plan our policies, uh, and we are able to deliver this preventive health model. Now I'm happy to say this was shared with NITI Aayog, and I would also kind of say that we were earlier before the first state to do it in the last 1.5 years, and the Ayushman 15 and other things. This was taken up to national level. So the third aspect is, of course, housekeeping. Housekeeping is the drug procurement, medical. So we have established a complete authority. It's the first in the country. We established under the chairmanship of the Chief Minister's independent authority with statutory powers. Now, why this is important is that this kind of an authority has the leverage to allow innovation. It's not just going to be an L1 model. Suppose we find an innovative product, the authority, being an independent authority, can take a call on encouraging a startup. It could be a pilot, it could be a kind of a PPP. So we have kind of, so medtech, AI based solutions, IT solutions, and so on are integrated in our procurement model also, so that we are not just encouraging on paper, but practically we want to work with them. So government of Maharashtra is going on a very different way to do it. And briefly, the third part is, of course, massive amount of um, cost saving is coming through digital health. So, which is our, in fact, cost saving to whom? To our department. See, we have close to 18,000 crores budget, but by using digital technologies, we are seeing huge savings. And also, lastly, when we look at digital health, we see actual saving on in the pocket of out of pocket expenditure. If I say I am going to build another hospital, one day's wages, travel, food costs, free healthcare is not really free. There's no free lunch, as economists call it. Nothing is free. But if we take the healthcare to the doorstep of the people, in fact, I'm happy to announce we are in the last stages. We're waiting for the elections to get over. We are launching even something called Hospital on Wheels. It's a dream project of our Chief Minister. So this is a digital bus. It has got teleconferencing, teleconsulting facilities. People are going to walk in with papers and walk out with the EHR. It's a dream project which I am going to launch very soon. So we are taking healthcare and digital healthcare to the doorstep of people, and it will. I think it's about. There are statistics of ministry around 3,000 to 3,500 rupees is the out-of-pocket expenditure per capita of citizens. We want to bring that down. We also made all healthcare, even fees, zero in Maharashtra, which has increased our OPD 1.5 times. So we do something like 20 lakh, 25 lakh X-rays a year, about 2 crore new OPDs. So a lot of things are happening, and digital is in the heart of it. But only thing I want to say is there are still areas untouched by private entrepreneurship. IoT in healthcare, where is the blockchain in healthcare? There is enough to do, and these platforms will definitely help it. Thank you.
Excellent initiatives. I think we can like have an applaud for the government of Maharashtra. This concept of like healthcare on wheels, our hospitals actually reaching out to people, and various procurement reforms which are happening, and various other initiatives are all laudable. And of course, like there's miles to go, lots to happen. And we have with us Dr. Urvashi Prasad, who is the director at Office of Vice Chairman at the NITI Aayog. And as we are all aware that NITI Aayog is the topmost policy making body of this country, and they are working at the national level and the central level, and they are like influencing and building the whole roadmap for the future. So, Urvashi, over to you, that your vision and ideas about usage of IT in the healthcare and how it can transform India.
Thank you, and I think appropriately so. We've heard from the states first, because I think that's where the action really lies. But I'll make a few higher level points, looking at it from the national point of view, and then also the work that we're trying to do with states as NITI Aayog. So I think clearly COVID was a watershed moment when we specifically talk about digital innovations. We saw telehealth really getting a fillip, And it is, in fact, around that time in 2020 that we even came up with the telemedicine guidelines, which was the first time that something like that had really happened. And also the whole digital vaccine certificates. I mean, it's still incredible that so many developed countries around the world continue to issue physical vaccine certificates, whereas we, had moved to digital through 𝐏𝐚𝐽 for such large numbers of people. So I think it's a huge acceleration that we got through a very unfortunate event, which was the pandemic. But I think it's important that we're able to uh, really continue to build on some of these, this momentum that we got, and also to be able to really scale it up and embed it within the health system. I think, as a public health professional myself, I feel that every level of the health system, needs these innovations to be embedded and to be made an integral part if we are to achieve scale, and especially at the public and public health and primary care level, because that is where I think the biggest opportunity for India lies. We've historically been a very hospital-based health system, very cure-focused health system, and where most of the country really, the entire country needs to move is towards public health and prevention. And I think that's where we really need a lot of innovations to be embedded into the health system. Screening, for instance, I think is a big opportunity. And we now have a number of startups that are using artificial intelligence to screen people for, say, tuberculosis or for lung cancer. So we need to do a lot more of this because prevention, as we know, is always better than cure. And we have a very large population. It's very difficult to cure people when they've already got advanced illness. It's also very expensive. So we need to really focus on innovations at the public health and primary care level. I would also say that it's very important to build capacity. When we talk of digital innovations, technology-based innovations, capacity of every stakeholder in the ecosystem, how to use these innovations, how to embed them in their daily work, whether it's health workers, whether it's officials at more senior levels, how do we really use the data that is coming out of these dashboards, make people comfortable with it. I think that capacity building is a very, very important aspect of trying to make sure that these, innovations scale up and are also sustainable. I think as far as our work is concerned at NITI Aayog, I think what we're trying to do is work with states. We now have a state support mission, which has been formally launched, and we've entered into agreements, partnerships with many states to really help them focus on many aspects of their development as we move towards Viksit Bharat at 2047. And I think healthcare and innovation in healthcare is clearly one of those very important areas where we would want to work with states. We would want to provide hand-holding support because, like I said, sometimes the ideas don't necessarily translate into integration with the health system at the practical level and more so scaling up. So I think there's a lot of work that we need to do on that front. And that is certainly our endeavor through the state support mission. But also I think what we have been trying to do over the last few years is look at the digital backbone and really look at various aspects of integration of different health systems, data systems, as well as privacy, ethics, consent, security of these systems. Because when you look at health data, it's a very sensitive issue. So when we're talking of sharing data across platforms, maybe even public and private platforms, integration, we do need to be aware of these issues and we need to have standards in place. So I think a lot of our efforts in the last few years have gone on trying to build this digital backbone. I would say it's still work in progress. And obviously, every state will have its own way of doing this. But we are at least attempting to provide the broad frameworks for some of these issues to be addressed and for us to be able to learn not just from other countries, but more importantly from what our states are already doing. We've already heard of today so many good practices from 2 states. Similarly, in every state, there's so much good work happening, and we want to be able to provide a platform for an exchange of those learnings and best practices. So I would say that's really our role, and that's how we're looking at it. But as I said, in India, in the health sector, really the most important action is at the level of our states. So that is where the focus must lie. Thank you.
Excellent inputs, and we can have a round of applause for Urvashi ji. And she has rightly pointed about the basic issue at the primary healthcare level, where the whole action is. So I will specifically request each of the states to actually talk about that, what's happening at that level in the rural area where there is a primary health center, because that's where the most level of investment, reforms, and action has to happen. So and how IT can help there. So if you have any success story examples to talk about that.
The biggest success story is Health and Wellness Center. So now we have CHO. So not very far in the past, very recently, we hardly found anyone when I was district magistrate, the A&M center. So we heard about, at that time, there was provision of at least you will get paracetamol there. So nobody were there. Now, can you imagine more than 20,000 health and wellness centers? So there we are reaching with whole gamut of health services at 5,000 population level. So you have more than 16 lab tests facilities, more than 60 drugs, and teleconsultation facility there. So more than 20 doctors is there. And there is a concept of hub and spoke. So recently, just now, 2-3 days before, we have integrated lab services there at that level, where you have a lab test and you will get on your mobile the lab test report. So just now it has to roll out. So at that level, IT initiative like teleconsultation. So as I said earlier, so if we are able to screen everyone, so we have done MOU with IIT Kanpur. So as Urvashi she was saying about this screening, AI-based, like we have done MOU on AI-based screening of all TB patients. See, this works like this. So you have legacy data. So based on that, if any computer operator, he scan all the suomoto, we go there, that is very harmless. So you scan, and based on that, you have almost sure that these are the people who are probable TB patients without going by any test. So we have this huge geographical area, and that is 75 districts. So now you have, you can prioritize your resources. So you can bring, you can issue schedule, we will test these people. So can you imagine if you are able to do this successfully? So that will become complete TB free. Similarly in the cancer, similarly in cataract, this AI based. So at the cutting edge level, suppose we are able to do these things to every person. So that is universal health coverage. So now the thing is how to bring a specialist and ICU at the cutting edge level. So recently the Reliance has done with Balrampur Hospital, the ICU, tele ICU. That was very successful. I was really surprised to see. So 24 hours they are available, the whole specialists in the Reliance. And our doctors in the Balrampur, they are completely in touch, and they are so much, they are skilled now. So they are running this dashboard, and HMI is like a very trained engineer. So this is biotech now. So this is really, in IIT Kanpur, you will learn very soon the medical college in IIT Kanpur. So now AI-based thing is coming up with, like, we can develop personalized medicine because we can do genome mapping already done, so we can, based on genetic mapping of yours, doctors can advise personalized. So it is not possible without using this technology. So we have a lot of hope. We are working on so many things. So the biggest thing is the health and wellness center at the cutting edge level, that is very successful. More than 5,000 sub center are coming up in next few years. Also, we are working with many organizations like Apollo and the Vedanta, the medical, this mobile medical unit, like he was talking about the bus. So that they go. Can you imagine? We have more than 13 crore OPD per year. So it is a huge health facility, more than 40,000 health facilities. They are working day and nights. There are challenges of human resources because now we are thinking about developing cluster of residences at the block level. So we are experimenting with in 5 cities: Gorakhpur, Varanasi, Lucknow. So we are developing a good cluster where the modern facilities and all to attract people to stay there. Once that will happen, and then we can ensure this quality health services through IT solutions. Without this, and look at the market, more than 900 lakh crores market. So definitely all over the world, people are thinking this is viable and profitable market. So we have to get into that. So UP is working on that.
Excellent initiatives. I think hats off, and especially you talked about the rural areas and the primary healthcare center. A lot of action is happening. Thank you for that. Nawin ji, you can highlight.
Yeah, thank you. So as you rightly said, the primary healthcare is the most critical thing. Now, solutions, are we going to build more PHCs? Is that the solution? Are you going to build more sub-centers? Is that the solution? So one part is actually the manpower part, one is the infrastructure part, then the knowledge, then services, and so on. So the supply chain of medicines and services, everything needs to work together in tandem to actually deliver. So Maharashtra has an interesting solution to the manpower issue. So we have the bonded doctors scheme. So the PG students are essentially required to work in with our department, and only then they complete their course. So that has been a game changer. So the shortages of manpower is actually reduced. In fact, paramedical staff, we don't talk enough about paramedics who are essential to the delivery of services. I'm happy to say we have recruited close to 12,000 paramedics this year and 2,000 plus doctors, apart from the contractual and bonded. So manpower issue in a state like Maharashtra used to be the most contentious problem when I was in the field. There was terrible shortage. Now that has been taken care of. Now what the issue comes down is, okay, infrastructure is there, but how to actually deliver services? So now we are going one step ahead. Now I'm happy to share that we are looking at the PPP model as one of the great ways to do it. So we've got HLL, is a PSU, we've got phlebotomists sitting at every PHC now for spot collection. So in a hub and spoke model, blood tests are being done at sub-center and PHC level on a daily basis. So within hours, we have turnaround time, we get digital thing. Unimaginable few years ago. So diagnostics, and we are slowly bringing down the accessibility of physical diagnostics like X-ray, MRI. Now every district we are going to have MRI machines. We have also brought in specialized services. Now we have opened cath labs, right? Again, completely unimaginable few years ago. Now, very bold step is also getting into things like specialized care, which is cancer care. So we have got day care centers. So we are looking at not just delivering essential services, just slowly, I think in the next 20 years, let's look at Viksit Bharat target and so on. the concept of PHC being a primary healthcare unit will vanish. This is my reading. So we are going to, what is a developed country? Where there is no difference between a rural and an urban service layer. You look at Europe, somebody told me, one of the people from the World Bank said, there is nothing called rural economy anymore. You can access every kind of service everywhere. It's probably just the conglomeration of people are different. So can we get urban level services into rural area? I think that's the way we are building it. And I'm very positive Maharashtra will be at the forefront. Regarding innovations, I just want to highlight one peculiar thing, which is the private sector healthcare in Maharashtra. If you ask me to do a SWOT analysis, so that's the time of buzzer. So the SWOT analysis, it's on time. The SWOT analysis is saying the time's up. So the SWOT analysis of private sector is the strength of Maharashtra is the private sector. Opportunities also in private sector. The weakness is also in private sector. The threat is also in private sector. Why do I say this, in a responsible position? Because if the public system fails, people have no other choice but to go to the private. Hence, the challenge for us is to match the delivery, because a very highly developed private sector. And affordability, why is a threat? The costs of services in the private sector are not going to go down. They are going to go up. All this talk of value-based, medical care is good, but the reality may be different. So we are trying very hard to get private sector also on board through PPP models, through Ayushman Bharat, through our state scheme, to come on a affordable level, and so that there is no this artificial divide of private and public in the long run, next 20 years, will slowly vanish. Thanks to digital health, thanks to the pipeline being built by NHA, we will have maybe one hospital where one block is for people who can pay and another block which is at government rates. This is the kind of PPP model which we are envisioning, so that the quality remains the same, but the payability, the affordability will be different depending on the capacity of the person to pay, not the quality. So this is the kind of vision which we are building in Maharashtra. And the NHA pipeline, the health information exchange platform, and it all kicks in big time. Lot of things are going to be seamless. The last point I would like to make is, we are now transacting on UPI on our phone. Seamless. We take internet for granted. TCP IP protocol is seamless. We don't even think of SSL layers in while doing credit card transaction. We are showing our boarding passes and going on flight. Planes are flying on autopilot. That is all understood as a layer. So health data and health security is going to be a layer in the IT network. It is not going to be something we're going to talk about. It will be taken for granted because it's going to be a standard layer, just like your cable TV running in your home. So that is the vision of digital health in India. I think we are all on the same path. Thanks.
Excellent vision, highly futuristic. And since Nawin Sona ji has talked about role of private sector, so let me request Urvashi ji to just speak about what is the role of private sector in healthcare? How do you see the vision?
I think, public-private, I think in health, it's something that is the only way forward, because, we have such a substantial and also in many parts a very vibrant private sector. So I think, of course, that is something that we have to do. But the question is always of being able to build that trust across both, stakeholders, because often I think public-private partnerships, sometimes there's a little bit of a inherent mistrust that can come up, or there's differences in principles which have to be aligned. So I think those are issues that we have to address in any sort of public-private partnership. and make sure that, ultimately we're working towards a common objective. But of course, the specific needs of each stakeholder and what they bring to the table is different. So I think that is why it becomes very complicated sometimes. But I think there's a lot of success stories also, and we need to try and focus on those. We need to try and scale those up. But of course, when I would say, private sector in health, we also have to realize that in many parts, it's also a very informal private sector that we're talking about. Not everywhere are we talking about just a formal, organized, corporatized kind of setup of hospitals, etc. You'll find in some places very small establishments, a few beds, nursing clinics, this, that. So I think there's a lot of heterogeneity as well in when we talk of the private sector in healthcare. And so we need to be able to meaningfully engage all those providers into our network, make sure that they also have a certain minimum level of skills and standards that they're adhering to, because healthcare, as we know, we're dealing with people's lives. So it's not like selling any other product or service. It's very different. So I think that is the only concern area that I would say that we have to be cognizant. And of course, we've been trying to address that even at a government level or policy level. But I think other than that, it's really the only way forward, given our country, our context, our scale. And also there's so many strengths. There are inherent strengths in the public sector. There's inherent strengths in the private sector. And I think if those two can be married effectively, there's so much that we can achieve in terms of outcomes.
I think this panel has talked about that how the public and the private sector can collaborate and work on the strengths of each other, not on the weaknesses of each other, of course. So there is a paucity of time. The buzzer has already rung. Actually, I wanted to have more of a Q&A, but we will have our speakers later in the other sessions also, so we can have some more interactions. So we will end this session here, and I really thank our distinguished speakers for joining us. Thank you so much. Thank you.